Hello, I'm Rebecca Davies with Save the Children, and good morning to you all from Canada and the United States, and good afternoon and good evening to the many of you who are all around the world, many donors, supporters, partners who are joining this call because of your concern for Yemen. And we're here today to mark a sad anniversary, 6 years of conflict in Yemen, one of the world's poorest countries, and also one that's now sadly on the brink of an enormous human-made famine. Now, as humanitarians, we're very careful about not ranking the misery in the world because there is a lot of it, but it is also sadly accepted that Yemen continues to represent the world's largest humanitarian crisis. And that, of course, is 6 years of conflict as well and exacerbated by it. That's 6 years of children suffering, 6 years of children being killed on a daily basis, 6 years of children missing out on education. And in fact, tomorrow Save the Children will release a new report showing that for the last 3 years, 1 in 4 of all casualties in Yemen are kids, 1 in 4. So we're all on this call today, all of us, donors, supporters, partners, because we care, we want to help. And we also have on this call some Save the Children staff who are closest to the children and to this humanitarian catastrophe. And there is some hope. They will show that thanks to you all, Save the Children is able to make a difference, able to give help despite little end in sight to the misery in Yemen. But our interventions are providing hope, and that hope gives something for the families and the children to cling to. And so thank you so very much. Thank you for not only your donations, but also your time on this call today. It's time spent in solidarity for children who are living a nightmare in Yemen. So before I introduce our speakers, we always want to start with children. That's who we are here for. So let's start with a child, and let's meet Yasmin. Sylvia, please. Thank you. That is a brand new film that's under embargo until tomorrow, but we wanted you all to see that today. And it's the work of my colleague, Sami Jasser, who is in Yemen right now. He's our multimedia producer for Save the Children in Yemen, and is also a father of a 6-year-old. So I'd like very much, Sami, for you to come on and speak to how, your work and also your perspective as a father of a daughter who is the same age as this conflict. Thank you.
Thank you so much, Rebecca. My name is Sami. As Ad introduced, I'm the multimedia coordinator of Save the Children in Yemen. I have always been proud to say that I'm from Yemen, that historic and peaceful country, the country that I have always dreamed to be all over the news with its people achievements, success and kindness. Unfortunately, it turned to be all over the news the other way, as the worst humanitarian crisis in the world. a man-made crisis, unreasonable conflict, and war on civilians and children that they didn't ask for. I have always dreamed to travel, but guess what? I actually achieved my dream. I'm now traveling to different cities around Yemen, but unfortunately, due to the 6 years ongoing war, I'm now traveling to hear the people struggling, children crying, and mothers wailing for their loved ones. But there was always that little hope from children. I honestly don't know which story should I tell you about. Should I talk about that? The children I made to survive the bus full of children attack in Sada? Or should I talk about that mother who eats less just to keep her children alive or eat? Or should I speak about the family that I visited and they're eating only bread with black tea for like one meal a day? Or that little child in Hajjah who inspired me and gave me more hope, and he wants to be a doctor to help people for free because he sees many children need health assistance because of the conflict. I'm sorry, but it's really frustrating experiencing these stories every day, and actually falling asleep is what gives us a push to start next day. I have that little girl who's 6 years old, as Yasmin. The story of Yasmin that she was coming back from school with her brother, and when the other sister opened the door for them, a sudden shelling hit the third floor of their house, causing rocks to fall over them, and which made injuries in the head of Yasmin. She was under surgery, the first one, and the second one is still coming when the doctors decide that. We have helped Yasmin, but unfortunately her brother Rashad, who was just 11 years old, passed away on the second day. Mm-hmm. If you can see in the photos, yeah, this is the photo of their house. That third floor was hit by the shelling, and as I said, when they were just coming back from the school. So these are the stories that we experience every day, like children dying, schools destroyed, civilian infrastructure attacked, and so on. Just yesterday, when I was preparing for this session, an airstrike hit the city, the capital city where I live in. This is not only an attack on the capital city, but the whole country is under ongoing war. I'm afraid that one day I'll introduce my little daughter as this is Sama, a 6-year-old child, because all my child has known is only war. And this is actually a man-made conflict. So I believe there must be a tailored solution to end this catastrophe. And until we reach that point, please help us standing on our feet, keep donating, save lives of children and save lives of civilians. Thank you so much.
Well, thank you, Sami. How do you... Go ahead, please.
Go on, Rebecca. That's
no, you go ahead. You go ahead.
No, okay. I just saw the other picture of this child who's called Omar. Yeah, this child is in Taiz, and he's being killed in one of the hospitals that we Save the Children are supporting. This is one of the photos that give me hope just to continue for a second day. Omar has malnutrition, severe malnutrition. His mother is there, and his father is now jobless because of the ongoing war. His mother was sent back to her family's house because the father cannot take the responsibility of paying the rent and so on. So there are some really strong quotes from Ruqayya, who's the mother of Omar. She said, like, the war is extreme, no room for peace. We are not safe. And she said a really good thing that she has only 4 children and they are the secret of her happiness. So putting yourself in her place, what happens if you lose a child who cannot even afford dinner? This is really really frustrating, but hope is always there. We can help ourselves, but we need you as international community to help us reach that point of peace. Thank you so much.
Thank you, Sammy, for sharing that and for all the work you're doing for Save the Children. I'd like to bring on Dr. Mohammed Mohsen, please. Dr. Mohammed is a medical doctor who works very closely with child protection and conflict casualties as well. And Dr. Mohammed, are you there?
Yes, please go ahead, Rebecca.
Thank you. Thank you very much. You are the Child Protection and Child Rights Advisor in Yemen. And I'm going to ask you to speak, please, to a press release that's coming out tomorrow that shows a large amount of all civilian casualties, as I opened up with, are children. And Dr. Mohammed, you've seen these injured children on the ground in our health centers. How difficult is it to care for them and help them recover in a conflict zone where they could just get injured again?
Well, thank you so much, Rebecca, for the question. Unfortunately, in Yemen, every day, children, they are struggling to survive the triple threats of bombs, starvation, and disease. So children have been enduring the terrifying routine of the relentless fighting and the violations of their basic rights. The scale of the airstrikes, the ground fighting since the escalation of the war, which has erupted in 2015, has reached unacceptable tolls for the children and their families. While we're speaking now, there are 49 active front lines in the country. Wow. In comparison, I mean, like in comparison to the start of 2020 when it was only 38. Although this in 2020, Save the Children International in Yemen, they have reached more than 100,000 of boys, girls, men and women with child protection, child rights governance, psychosocial support, victim assistance, supporting the vulnerable children and their families in Yemen. It's important to know that working and provision of humanitarian assistance in a conflict-torn country impacted with COVID-19 is challenging. Especially the health system is at the point of breaking down, like with almost 50% of the hospitals are partially working and functioning, and a lot of hospitals have been damaged by airstrikes, by ground fighting, and in addition to the extended reduced medical funds, medicines, qualified staff, all of these many reasons that the injured children in the field that we meet every day do not have access to specialized health services. So Save the Children, with the collaboration with the Ministry of Social Affairs and Labor, social workers, and the community-based groups that are trained by Save the Children on identification and referral of child protection cases, they escort them, they provide the support that they needed, although it's also challenging for them. Yemen, the situation is unpredictable, it's risky, and with the limited resources, the limited money, the medical capacities, and then finally when we arrive to like the recoveries of the children, injured children, and sending them back home, also they are likely to be exposed to a child protection risk. They can be exposed again to killing, maiming, and other violence. In addition,
can you give an example of what a child protection risk is, Dr. Mohammed?
Yes, such as killing and maiming, sexual exploitation, all of these children are exposed to it very easily because of the conflict happening in Yemen. And for instance, the one of the examples is that like children, they are experiencing armed conflicts during their childhood and adolescence. This possesses like really serious mental health risks and threats on the children's well-being and development. And exposure of that and the intensity of the war, in addition to the duration since 2015, worsened the situation. Like in February 2020, Save the Children in Yemen, they've conducted an assessment. I was one part of the team that did surveyed more than 1,000 of the children on ground with their caregivers. Almost 1 in 5 children, they always feel afraid. Many of the children that we have interviewed, they have reported possible signs of anxiety, such as increased heart rates, stomach pains, shaky hands, sweaty palms, etc. So, and unfortunately, the funding of the management of the children impacted by the war has been slashed by almost half in 2021. Without any additional funding, more than 8 million children will be facing crisis levels of food insecurity in Yemen by the middle of this year. 2.3 million children under 5 are expected to go hungry on this year, and more than 10 million children in Yemen are in need for healthcare services.
That's a big number.
I'm sorry, but this is the reality, Rebecca.
Dr. Mohammed, you've led teams, humanitarian responses in epidemics, and in not only Yemen, but in Syria and Bangladesh and Uganda. Can you tell us what about Yemen in particular makes it the world's biggest humanitarian crisis?
Thank you so much again, Rebecca, for this question. So as I'm a Yemeni, and I'm a humanitarian worker who has been serving the communities and being involved in emergency situations and developmental processes in different contexts since 2013. Yemen is one of the most complex crises. The world's largest humanitarian crisis, with 66% of the population in need for humanitarian assistance, 11.3 million children of them. The situation is very worrying and it's very concerning. As I just mentioned, 2 million children will be likely malnourished in 2021, and around 400,000 of them are more likely to be dying because of malnourished situations. This is representing an increase of 16% over the last year. In the second half of 2020, we have seen more than 50% increase in the child malnutrition admissions in some of our health facilities that we're supporting. So protection of civilians remains a priority for the Yemenis, which is like because of the conflict, more than 12,000 civilians are casualties until now. In 2019, the United Nations have verified 4,042 grave violations against 2,159 children. 1,447 children are killed and maimed in Yemen in 2019. 20 attacks on schools, 15 on hospitals. More than 7,000 children are experiencing separation from their families and caregivers. So, and for Save the Children in 2020 also, we identified 316 survivors of grave violations in comparison to 2019, where we identified and supported 482 survivors of grave violations. Most of them, they were injured by airstrike, by shellings, by explosives. We provided case management support, we provided victim assistance, we provided psychosocial support, we disseminated messages to raise awareness, especially with the child clubs and the community-led groups. However, on the 1st of March 2021, the United Nations converted a virtual pledge, high level for international humanitarian donors. It was co-hosted by the government of Switzerland and the government of Sweden. Unfortunately, the international community let down the Yemeni children and their families again from reaching the target of the pledge of $3.85 billion. This continued failure is compounding this crisis. In SCI Yemen, the overall funding gap for the management of children impacted and slashed by half, as I just mentioned. It is expected that if we don't have additional fundings by the upcoming next 2 months, around 15,400 children who are currently receiving critical services by Save the Children in 5 of the governorates, Ta'az, Hudaydah, Eb, and Adan, and Sana'a, will be really in risk, in immediate risk. This is out of 100,000 boys and girls who have been identified by the Child Protection Area of Responsibility in need for acute child protection needs in Yemen.
That's outrageous. Thank you, Dr. Mohammed. Really appreciate that, and please stay around. And for everyone on our call, please ask any questions in the chat, or you can save them to ask our panelists directly in a few minutes. So we really appreciate everyone who's on this call today. We have humanitarians like Dr. Mohammed Mohsen. We also have humanitarians like Anna Pantelia, who's in Yemen as well. Anna is a media and communications manager, and humanitarian aid is delivered not only through medicine, it's a very critical part of it, of course, and through logistics, but also through, as Dr. Mohammed said, raising awareness. So Anna, could you take a few minutes, please, and show us some of your most recent work documenting the conflict in Yemen? And I should have said this before, some of the images are quite distressing, if you're sensitive to that. But Anna, please tell us some stories of some of the people that we're concerned with. Thank you.
If you allow me, Rebecca, first of all, I just wanted to say how happy I am to see the faces of our donors, because we don't get the chance, us in the field, to meet them. So I really want to thank them for spending the afternoon with us, despite the fact that I know what they will see will make them sad. But I'm happy to still see people like our donors who still care about what's happening in Yemen, and they give us power to continue what we do. So thank you for that. Thank you for being with us. So I'm in Taiz region. It's one of the regions that Mohammed just mentioned before. And the boy you see in the photo is Omar. He's 8 years old. And he got medical treatment from us. And this is also the treatment that we cannot support for all the children that we are having at the moment due to the cuts in the funding. So in this region, we see lately escalation in fighting. And children like Omar that you see in the photo, they live in Taiz right now. Just 2 weeks ago, 20 children got killed and injured in just 3 days, just to give you an idea of how is the situation in the city that Omar lives until now. And these children were either attacked in their home or returning from school. And this is a daily reality for people in Taiz and other parts of the country. And this is what the mother and the father of Omar told me when I saw them in the hospital a few days ago. So they lost one child in the saline attack, in the explosion, and that was Omar's brother. And Omar got injured himself, and now he's trying to recover in the hospital. So Omar had to see his brother dying before his eyes, and now he's recovering from his injuries, as you can see in this photo from the hospital. His mother told me that often he says he wishes to have another explosion so he can go and play with his brother in paradise. That's what he's saying. And I think it's very shocking to hear something like this from an 8-year-old child who normally should be going to school and have a normal childhood. Also, what surprised me with other children that I spoke in Yemen about their life all these years is that these children are exposed to multiple traumatic experiences. It's not just one. I met children who in a few years they have been displaced, they got injured, they lost loved ones, they dropped out of school because they have no other way to survive. They have to support their families. And it's difficult to get out of this cycle of suffering in Yemen. We can support the recovery of these children. We try to support, but I'll tell you one thing. As Mohammed mentioned before, I speak to our colleagues in Taiz who support these children, and specifically Omar, for example. They need to reduce the number of children who get medical treatment because the budget is not enough to cover everything. It's just, as it's mentioned, half of what it was last year. So we have to deny some children from treating. And we're trying to do our best to recover all these funds, but it's impossible with the situation that we're seeing now, with the pledges that it was pledged in the pledging conference earlier this year. So it's very important in any way that you can to step up and continue supporting us so we can continue saving lives of children. And thank you again for being with us tonight.
Thank you, Anna, and be safe yourself. And you're, like Sami, very, very talented at capturing the crisis and the soul of Yemen. Thank you. Once again, everybody, that's a gripping photo. I'm Rebecca Davies with Save the Children. You are on a special briefing for donors, supporters, and partners of Save the Children on Yemen to mark the sad anniversary of the conflict. We're going to pivot now and speak about some of the wider concerns beyond conflict in country. And before we do that, may we please see little baby Omar that we saw earlier in the chat in a photograph as a film. And again, this is the work of Sami Jasser. Thank you, Sylvia, for showing that.
بالأكل يعني نعمل التقصير يعني نقصر يعني علشان الجهل، وهذا يعني لما يكون واحدة ما فيش يعني اللي يعني يجيب لهم.
Well, that's short, but it cuts right through, doesn't it? Like to bring on Gabriella Wyman. Gabriella's in the UK. She is Save the Children's Global Humanitarian Director. And Gabriella, I know you're now leading the Save the Children Famine Prevention and Response Task Force. Can you speak to us about your concerns with Yemen specifically, from conflict to famine? Thank you.
Thank you, Rebecca. And just a little word about that movie. What makes that little clip so special is because you see the love shining through, both from the doctor, the parent, and also the child back, and that's ultimately what it is all about, isn't it? Anyway, but back to the reality of the day. We are very, very worried about Yemen. We've been worried about Yemen for quite some time. As some of the colleagues already alluded to, without substantial increase in funding, millions of children are going to be at risk of malnutrition in Yemen. And to be very, very clear about this, malnutrition in its worst form kills, it stunts, and it creates disabilities for life. And thousands of children are at risk. You heard the numbers a little bit earlier, about 15,000 people or children at immediate risk. Now, while I have the floor, actually, Rebecca, I really want to express I fail the words actually for this. I don't understand why there isn't more outrage, in the world or among the public. I have seen how collectively we can come together for COVID. I have seen how governments have been able to open the purse strings and bring out trillions, programs worth trillions. Thousands of people are volunteering for COVID. I myself am volunteering hours of my time over the weekend to help roll out the vaccines here in the UK, where I'm based. But somehow it seems that the world, I don't know, is not getting overly excited about these kind of things. Why are we struggling to get cut through when we are seeing a child dying? Are we okay with cutting assistance for children that are starving? What one of the colleagues mentioned earlier, we're failing to raise the 4 billion that is needed to save their lives. And we need to be much more angry about this globally. Now, some of our large institutional donors are actually cutting aid to Yemen right now. I was absolutely shocked to hear that the UK proposed to cut 60% of their funding to Yemen in 2021, right now, 6 months after they themselves launched a campaign, a global call to action to prevent famine. And now it's slashing its own contribution to a country like Yemen, which is at the brink of famine. Hundreds of thousands of children benefit today from support provided by UK aid. What is going to happen to those children? And not only to pick on the British government, in 2018, we collectively as a world supported Yemen with $5 billion. In 2020 with $2 billion. So it is not only the UK that is off-ramping its assistance to Yemen. There are a lot of institutional donors that are actually reducing their funding in the hour of need, and it's absolutely unacceptable. However, there is something we can do, and as we saw from the photos and as we saw from the movie, you know, there are real children and there are real fathers and real mothers behind the statistics that I just mentioned, and there are thousands and thousands of stories like the one from Omar that you just saw. And I know that these figures, you know, the total figures are somehow a little bit overwhelming, right? But as the clip of Jasmine showed, there is something we can do. And just as an example, last year, when institutional donors for donor policy, political reasons, frankly, off-ramped, that was the term that was used, off-ramped their funding for Yemen, Save the Children stepped in. There were 56 clinics in the north of Yemen, clinics like the one you saw today, that are saving the lives of these children, children that are malnourished. 56 of these clinics were at risk. Save the Children stepped in with your money, with private funding. 3.5 million we put together, and we kept those clinics open, and we saw them through to the year. And I am so, so, so proud and thankful to all of you for having allowed us to do that, because now institutional funding, so big donors, are back online supporting those 56 clinics that you helped save. And all those children, thousands of children that went through those clinics, malnourished children, that we managed to keep alive because of your contribution. So thank you for that. Jasmine showed that there is something we can do. Your contributions, however big or however small, make an absolute difference. They save lives. Collectively, we can save many Yasmins. Individually, we can save one Omar at the time. And thank you for your support.
Thank you, Gabriella. It's hopeful to hear the big numbers and the big crisis broken down to practical things we can all do in our roles. So thank you very much. And thank you to everyone on the call. Again, not only for your donations, but for your time and engagement in this very, very difficult issue. My heart's pounding. I'd like to bring on now to join you in conversation, Gabriella and Dr. Mohammed and Sami and Anna, Jeremy Stoner, please. Jeremy is the regional director for Middle East and Eastern Europe for Save the Children, and someone who has a regional perspective on this. And we've gotten a couple questions, tricky questions, Jeremy, about some of the well-known perpetrators of the war. And would love very much your thoughts on that and some actions that people could take.
Okay, thanks very much, Rebecca. And as you say, it's really hard for me as a regional director to come on after presentations by Sami and Dr. Mohammed and Anna and Gabriella, but particularly our staff on the ground in Yemen, because our team on the ground are exceptional. I don't say that with ease, but they are exceptional and they are doing a great job. And so, I mean, this is really about 6 years of war on the one hand, but actually I'm also here to tell you that I've been working very, very closely with the country director and his team, many of whom you've had a chance to meet this afternoon. Last year, we actually delivered a huge amount for children, and we've heard quite a lot about that this afternoon. And so despite the conflict, we have done a fantastic job, and I'm immensely proud of the team in Yemen. I'm immensely proud of my team in the region and at global level, as we try and put pressure on all parts, on everybody, to serve children and communities. That's what we do. Our name is Save the Children. We're doing that in Yemen right now. We've been doing that for more than 100 years, and we get better and better at it.
What are you particularly proud of, Jeremy?
Oh, well, okay. I mean, I think Gabriella mentioned clinics. So, and the fact that we were able to keep those clinics running under some of the most dire circumstances. I visited Hajjah, which is the government in the north of Yemen on the border with Saudi Arabia, which has had its own share of conflict. And I visited a remote clinic in a district about 40 minutes from Hajj. It was about 44 degrees centigrade on the day that I visited. And it was a Friday. The clinic was open. Save the Children had provided running water, solar powered, dug wells, running water to that clinic to enable doctors, nurses and patients to be clean and have a clean environment within which to work, and also a laboratory for detecting diarrheal disease and also malaria. And there was a little boy there whose name I don't remember, but I remember his story. He was 11 years old. He carried his 4-year-old brother on his back, who was desperately sick, for 11 kilometers in 44 degrees of heat, arrived at the clinic on a day off. The clinic was opened and ready and served him and his needs and his younger brother, who was 4, to get better. At the end of the day, there's nothing like it. We set up a community water resource there, not just for the clinic, but for some of the households around there. And providing clean water is one of the best ways to avoid children under 5 dying of diarrheal diseases. But let's get back to that question about, the conflict. I mean, I think one of our strengths actually as an organization is that, Save the Children, we have maintained, I feel, and I'm happy to be challenged on it, but I feel that we've really maintained a huge amount of integrity as an organization in terms of not taking sides, but being very, very clear to the world and the international community and to everybody that is supporting this conflict, which has to end as soon as possible with a political solution. We've been very, very clear that the root cause of all of the suffering in Yemen is around the conflict. Without the conflict, we can start to rebuild and make things better. At the moment, we're doing a lot of work, which is putting sticking plasters on a dreadful situation and literally putting sticking plasters on children. But actually, the resolution of the situation in Yemen requires an end to the war. And, we have spoken regularly. I was, I think 2 years ago, a year and a half ago, I went to a conference in Saudi Arabia where my #1 message was, this war has got to stop, because without that stopping, we can't actually take things further. We can do a great job, we can support communities and children, but actually to really give children that hope through education. A third of the schools aren't working in Yemen because they've been bombed. Half of the infrastructure is destroyed. Half of the clinics are not working because they've been subject to the conflict. And this is just completely and utterly unacceptable. I mean, it's deplorable and it's a disgrace. And so we shout globally at all times to all parties in this conflict that we've got to stop the fighting before we can then rebuild the country. I'm sick and tired, actually, of Save the Children, putting sticking plasters on things and not going to the next level to really develop and support children right into their future. But with war, we can only do our best to actually support children in terms of their day-to-day needs, in terms of healthcare, education, and protection. So that's what we're doing. But we do shout about it at all levels, from the UN Security Council down to governments who are involved in the conflict, etc. But the war has got to end. We do a lot of advocacy around that. And we work with the UN and other bodies to make sure that that actually happens. I don't think it will happen in 2021. I think it's a slim chance, but we're always looking to build the foundations towards that peace that's going to guarantee children in Yemen a future.
Thank you. If not in 2021, when is the prospect for peace?
Well,
Jeremy, do you think?
I think with all of these things, it's really difficult to say, isn't it? We've seen in Syria, for example, sadly, this same month in Syria, there's been 10 years of war. And in Yemen, we're looking at 6 years, which is the point of this call. And actually, to have everybody on the call, so many people today, I sometimes wonder when I speak a couple of things. I sometimes wonder whether there's actually anybody out there listening, to be quite honest. So having loads of people on the call this afternoon is such a pleasure and an honor. And I mean, I don't say those things very lightly. And, because how can it be that governments around the world, some very important governments who have a reputation in aid, have reduced the amount of support to Yemen by 60% at the time of a famine and a crisis? And many governments, I think, have taken off the brake because of COVID-19, actually, everybody on this call has been affected by COVID-19. And I'm saying it's absolutely right that countries around the world, even the most developed countries, are looking a little bit more internally to sort out the problems that they have with COVID. And then, my goodness, we've lost loved ones, we've had loved ones who are sick, we've been hugely worried. Everybody on this call will know some story, and myself included. But just spare a thought, outside of our sort of frame of looking inwards, we have to start looking out again. And I think some donors have just taken their foot off the gas and allowed things to just slow down to a slow chugging along pace and forgotten about some of the things that they used to reach into their pockets, national pockets, to support. And I think that's a shame. I do think but part of that is the momentum of governments and the UN and Save the Children and all of us to make sure this is on the agenda at all times. So, I think if we can get the momentum going, we can bring the warring parties together, have some really serious discussions. I'm hopeful that we're going to see, I think, a breakthrough this year, I hope. And then maybe next year, who knows, building the stronger foundations to a peaceful resolution, to let children breathe, get on with their lives and grow up as they need to grow up and to be successful.
Thank you, Jeremy. And we will be shortly wrapping up. So please, we have questions. We can continue to answer your questions, whether privately and anonymously or into the box here. I do have one for you, Jeremy. And that is, how on earth can you operate our programs in a conflict zone?
Right. The good news is that Save the Children, I think, in terms of humanitarian support, I mean, we work in a number of conflict zones around the world. And it's something, sadly, but also something I'm personally hugely proud of. But sadly, because of that experience, we've built up some fantastic staff and experience historically into the current day to mean that in conflict zones, we can respond, I think, better than many people could ever imagine on the ground. So we can actually deliver things. So last year in our budget, I think we delivered over 90% of what we promised to children and communities in Yemen, despite the conflict. So on the ground, we have skilled teams who are able to negotiate their way into getting freer access to children on the ground and their communities to deliver goods and services to those children, in many cases to keep those children alive. So we've got great experience on the ground, a professional team, but also at other levels within the system. We work with, as I said before, we work with the UN Security Council, we work with a whole series of international bodies to try and drive change to make it easier for us to deliver. But at the end of the day, two of the big ports in Yemen that bring in the food, that bring in the fuel, have been bombed. And this means that without fuel, it can be really difficult to deliver. So we have to work with the international community to say, we've got to make sure that fuel can get into those into those parts of Yemen where it's not getting into in sufficient quantities so that we can continue to deliver. But, can you imagine a port being bombed? And it's a port that principally brings in food, and there is a famine in Yemen. And that food goes to children ultimately, under fives, who are vulnerable this year more than ever. Millions of children extremely vulnerable. When you're vulnerable and very sick with acute or chronic malnutrition, that exposes you to other childhood illnesses. Diarrhea. In an adult, you have a bit of food poisoning, maybe that's fine. In a child, that kills you. And this is a fact of life in Yemen. So when all of those things are taken into account, we look at alternatives to import. We have a team that we have a supply chain team that looks at all of the factors that we need to deliver in Yemen. And as I said, last year we were able to deliver 90% of our promise to children there. We're very good at negotiating on the ground. We're very good at working with the UN. We're very good at negotiating at the ports to get foodstuffs and other commodities into supporting children and communities. So we have the experience. We're professional. We're on the ground. We know what it takes. It's hard. It's very, very tough. And Yemen's one of the toughest places to work, I think, in many ways. But actually, we're delivering. And I think that's the good news story. But at the same time, working in that context day after day exhausting for our team on the ground, because I know that many people are exhausted now. On top of that, we have the COVID pandemic, etc. But, you know, it's that sense of what Gabriella described as outrage earlier, that unacceptability of what's happening. And, you know, somebody asked me the other day this question that I used to get a lot, and some people stopped asking me. Somebody asked me the other day, but I suppose you get used to this, Jeremy, in your job. This is something you get used to. Is I mean, you just do it as a sort of a business, and you're professional, you deliver, and your teams work and all this stuff. Well, no, you don't actually. You don't get used to it. It's as shocking today as the first day that I started working in humanitarian context 30 years ago. It's as shocking to me today as it was then, but even more shocking now, because here we are 30 years later, and the same things are happening to children in Yemen that are unacceptable and inexcusable, and there are solutions. So, you know, I know that we can deliver, and I know what it takes, and I know that the team on the ground are fantastic. Yeah. There's a gaping hole in governments putting their hands in their pockets to support Save the Children and many other organizations working on the ground. And yeah, we can do it. But my goodness, what a dreadful situation that we're in now. But I'm very confident that we will see this through, and we'll go on to the next level when peace returns to Yemen, and we'll really start building up schools, building up healthcare again in a way that's sustainable for the long-term future of children.
Thank you, Jeremy, for your outrage. We don't say that very much at work, but thank you for your outrage and your commitment to children. And while I've got you here, what does that gaping hole look like for you? You're the regional director. You've got over 100 people on this call who are concerned as well. What practically does the operational budget look like, and how can people on this call help?
Oh wow, my goodness, you know, I think one of the things that I'm very proud about of Save the Children in Yemen is that we do work across the piece. I mean, we're really passionate in Yemen about our work in the health sector, our work in education, and our work in protecting children. And so, you know, some of the things that any monies that we raise will go towards this year in 2021 is that we're constantly responding throughout Yemen. We work in 10 governorates in Yemen. That's a huge geographical space, but we're constantly supporting, you know, small-scale emergency responses. There's been fighting in one governorate. That means that women and children and communities move because of the fight, because of in fear of their lives. But we're there to support them where they move to with food, shelter, and other goods and services. We always prepare every year for cholera outbreaks. Cholera is endemic in Yemen, but those cholera outbreaks require planning and support, drugs and clean water, etc. And so we're always planning, and we're always putting money into that. Plus, we also have things like we have localized flooding every year, which displaces communities as well, on top of everything else. But again, you know, there's been news of a lot of conflict in one of the governorates in a place called Marib lately. So we're actually planning to look at how we would be able to perhaps support displaced and vulnerable children in that very hard to get to province through local partners. In COVID preparedness and response, COVID, we all know about COVID, we've talked about it already, but actually in Yemen, they're actually, you know, experiencing a wave of COVID right now. We do huge amounts of work in terms of public health messaging with our communities and children across governorates around how to protect yourself from COVID. We do a lot of work in our clinics. Gabriella mentioned 56 health clinics just now. To support COVID, and we provide our staff and teams on the ground across Yemen with personal protective equipment to make sure that they're safe, not just in terms of delivering to communities and not putting communities at risk, but also for themselves. So any other monies we've got, I said, massive programs in education and health and protection, but any monies we receive goes into gap fill. We're always having gaps in supporting children right where they're needed. So those are some of the examples I can think of which are absolutely critical.
Good. Well, thank you for that. And together we'll see how we can raise the funds to meet those gaps for what assuredly are some of the most vulnerable, forgotten children on Earth. Thank you, everyone. Jeremy also said, besides money, advocacy is a huge part of the solution. And so if you are interested in learning what your National Save the Children office is campaigning for around Yemen, certainly how you can make contributions to this response, please go to savethechildren.net and you will be redirected to your national office. But I want to say to all my colleagues in Yemen, to Sami, to Dr. Mohammed Mohsen, to Anna, to Jeremy, to Gabriella, of course, and so many more who work for Yemen out of national offices and in country. Thank you so very much. And you're not forgotten. And to everyone on this call who supports or donates or partners or works for Save the Children, thank you again for your time. And as I said before, your engagement. It is solidarity, and it lifts the spirits and the hope for not only the people that are working on the ground, but the families and communities, and most of all the children that we do serve. Thank you very much for your time today. And yes, savethechildren.net if you would like to get some more information from your National Save the Children office. Thank you all.